So during any physical movement, muscles can play a number of different roles to produce or support that movement. The first two of those are what make up what we call the antagonistic pair. The agonist being the prime mover or the muscle responsible for creating the movement, and the antagonist, which is normally the opposing muscle, which will relax to allow that movement to occur. So in this situation, we've got the bicep curl. The dumbbell here has been lifted up. The biceps brachii has been the agonist. So there's been a concentric contraction here to lift that weight and allow the movement to occur. At the same time, the opposing muscle, the triceps brachii, must relax to allow that to occur. So generally speaking, you've got bicep in charge of flexion of the elbow, tricep extension, opposite movements. So when one works as the agonist, the other has to become the antagonist. The other muscle roles we can have, first of all, synergists. Now, synergists are muscles that assist the agonist in producing the action. So it has to be a muscle that works on the same movement. So in this situation, biceps brachii flexes the elbow. So synergists are any other muscles that also flex the elbow, and generally speaking will be weaker flexors. So in this situation, we've got brachialis here, brachioradialis, both elbow flexors, not as powerful as biceps brachii, but they will work to help, so they are synergists. The final role is for a fixator. Now, a fixator works statically, so that's an isometric contraction, statically to fix and hold in position the origin of the agonist. So remember, agonist is the prime mover, biceps brachii in here. The origin is the fixed point that doesn't move during action. So the origin of biceps brachii is on the clavicle and on the scapula, up here on the other side of the shoulder joint. So our fixators are all muscles that are going to stabilize this shoulder. Deltoids being a major one, but then within there as well, we've got our rotator cuff muscles. So just to summarize, agonist, prime mover, creates the action. Antagonist, opposing muscle, which relaxes to allow it to occur. Synergist, muscles that help the agonist. Fixators, static postural muscles that hold the origin of the agonist in place. Remember, if we had a bigger movement, every joint has its own agonist and antagonist, synergists and fixators. Okay. General rule of thumb, agonist and antagonist are normally on opposite sides of the body. So bicep, tricep, quadriceps, hamstring, pectorals, latissimus dorsi, rectus abdominis, erectus spinae. So if in doubt, just think about what's on the opposite side of the body.